Hi all, I'm Dr. Ritesh Malik. I'm a doctor turned entrepreneur and run a hospital called Radix Healthcare. We've seen a lot of cases of COVID in the past 1 year, and here I am to break a lot of myths about vaccination. So the first myth is that I got infected during the first wave. I won't get infected in this wave again. This is absolutely not true. COVID infection, which happened in your first wave, did produce some antibodies, but they keep on depleting with time. So, my urge for everyone who has got infected in the first wave is to get vaccinated whenever your chance comes, because COVID infection, which happened in the past, would only protect you from 3 to 8 months. Myth number two is that I have taken the first shot. I don't need the second shot. This is absolutely not true. The whole inoculation process is of two vaccine doses. The first shot will give you partial immunity only for 2 to 3 weeks. Second dose boosts that immunity, and the duration for that after the second dose is 6 to 12 months. So make sure that you get both the shots and have complete protection against COVID. The third myth is that pregnant women cannot take the vaccine, it's dangerous. So on this, we don't have a significant data claiming this, but yes, as of now, the government of India has requested all the pregnant women to not take the vaccine. Myth number four is women shouldn't get vaccinated while they're on periods. This is absolutely not true. Women can get vaccinated during their menstrual periods, and except of the fact that when they are expecting, they can get vaccinated whenever they want. Myth number five is that the vaccine can also make me an asymptomatic carrier. That is absolutely baseless. Anyone can be an asymptomatic carrier. The vaccine may render an infection to be mild, but you will still be infectious to others. Vaccine does not make you an asymptomatic carrier. It does not make you a COVID positive patient as well. Myth number six is that getting vaccinated is dangerous for breastfeeding mothers. In the US, breastfeeding mothers, lactating mothers have been given vaccines, whereas in India, there is no specific data for it, and no sufficient data to actually claim this myth. Myth number seven is that the vaccine causes infertility. This is absolutely not true. Vaccine does not cause any infertility. Myth number eight is that the vaccine has a lot of side effects. So when it comes to side effects, there are temporary side effects for 36 hours to 48 hours, but these side effects are mild. They are basically mild fever, myalgia, body pain, but these are only seen in 35% to 40% of the cases, and these only last for maximum 2 to 4 days, not more than that. So on the side effects front, it there are no permanent side effects, and the ones which are there are very temporary. Myth number nine is that once you take the vaccine, you don't need to wear a mask. This is not true, and this is a dangerous myth. Vaccine will only prevent I'm again saying this, vaccine will only prevent severe COVID slash avoid ICU hospitalization. After getting a vaccine, also you might get COVID positive, but you will be very protected in terms of what you would have been without the vaccine. It does not prevent mild reinfection and spread to others. So make sure that you wear a double mask whenever you go out, so that you can protect yourself in spite of your vaccine status. Myth number 10 is that people who have recently undergone a surgery cannot take the vaccine. Post operative patients can receive the vaccine. There is absolutely no data to verify this myth. And the only thing is that there should not be any active infection or immunocompromised state in the patient. But as such, post surgery, you can get yourself vaccinated. Myth number 11 is that people with mental health issues shouldn't get vaccinated. It leads to more depression and anxiety. This is absolutely not true. people with mental health issues, in fact, anyone who's not a pregnant woman should get vaccinated. These are absolutely baseless as myths, and they are doing a lot of circles on the social media. Do not believe if this. We run a hospital. We have seen that people who are vaccinated are more and more or secure and protected than the ones who have not been vaccinated. So my only request to all of you is get vaccinated. Myth number 12 is that people who smoke or drink shouldn't get vaccinated. It can lead to cancer. This is not at all true. High volumes of alcohol may interfere with immunogenicity of the vaccine, but socially acceptable quantities do not pose any concerns. Alcohol consumption can independently be a cause of cancer, but not with vaccination. Myth number 13 is that children shouldn't get vaccinated. It can lead to severe complications when they grow up. So worldwide, children have not been vaccinated yet because children are not susceptible to the disease as much as the older people are, because of which we do not have a lot of data to support this. In my opinion, children, whenever the chance comes, children will be opened for vaccination, and this is absolutely not true. Myth number 14 is that people with pre-existing conditions like diabetes, pneumonia, asthma, bronchitis, and hypertension should stay away from vaccine. It can cause death. This is not at all true. In fact, all these people should be the first ones in line to actually get vaccinated, because this disease, COVID-19, is extremely susceptible in patients who have diabetes, pneumonia, asthma, and other comorbidities mentioned here. The vaccine, in fact, can provide protection to these vulnerable people. COVID is more likely to cause serious disease and death in such people. Myth number 15 is that people who have taken the vaccines are also contracting COVID and dying. Partially true. Those who take the vaccines may develop a breakthrough infection. 0.03% out of 11.6 crore people who got Covishield, and 0.04% out of 1.1 crore people who got Covaxin. So typically, 2 people out of 10,000 inoculations of Covishield and 3 people out of 10,000 inoculations of Covaxin developed symptoms and got the disease, but there were no reported severe illnesses or deaths amongst the fully vaccinated individuals due to COVID. Myth number 16 is that the vaccine side effects could incapacitate me for 2 weeks. This is not at all true. Mild symptoms may emerge for 2 to 3 to 4 days maximum, not more than that. They will definitely not incapacitate you for 2 weeks. Myth number 17 is that I don't need the vaccine. Ayurveda will treat me. This is not true. Ayurveda can help you in boosting your immunity, but you need the vaccine. Vaccine is a very scientific is a very scientific administration of an inoculated virus slash dead slash inactivated slash live but engineered virus in your body, which will actually help your immunity to confer an immune response by giving a part of the virus to the body. So a vaccine is not at all is something which cannot be compared with Ayurveda. Ayurveda may help independently to build immunity and fight infections, but you need the vaccine. In my opinion, I believe that the only way for us to go forward and have this mess behind us, the menace that the COVID-19 virus has created and the havoc it has created in this world, is for completely vaccinating all the people of this planet against the virus. We have seen that people who have gotten vaccinated are developing far more milder symptoms than the ones who have not got. And this is one of the reasons that this time more than 65% of all cases in India are less than the age of 45, because people above the age of 45 have been vaccinated by the government of India. My submission to all of you is do not pay heed to any of these myths except of a pregnant lady. Get vaccinated. This will be the best thing that you can do for yourself and your family. We are losing unwarranted lives just because of the fact that people are not inoculated in our country. Do not pay heed to such myths. Get vaccinated, protect yourself and your family, and protect your country. Do your job, get vaccinated.